Hey, it's Professor Gould, and in this section we are going to talk about the rest of the axial skeleton. That is the skeleton that makes the axis down the center of your body. So this includes your whole vertebral column and your rib cage. The rest of your skeleton, the arms, the legs, the shoulders, and the hips, those are the appendicular skeleton, which are appendages to the axial skeleton. So the vertebral column, which is your vertebrae stacked on top of each other, starts out right below the skull. The first part is the cervical section. So these are cervical vertebrae. There are 7 of them. The second section is the thoracic vertebrae that makes up the, this is where the rib cage attaches to. This is most of your thoracic portion of the body. There are 12 thoracic vertebrae. And then at the base we have 5 lumbar vertebrae. These are all you can see, very tall, very thick and beefy. And then below that is the sacrum, which is a single bone, which started out as 5 vertebrae during fetal development that fused together to create this one bone. So what we're going to see when we get to the sacrum is that the features on the sacrum result from its history as being separate vertebrae. And then down at the bottom, we have the coccyx, or the tailbone. You will call it the coccyx. And your textbook says it's 4 vertebrae. It actually depends on the person. Some people have 3, some people have 5. When you're younger, these are not fused together yet. They fuse together usually when you're in about your 20s, and then when you're in your 40s or 50s, they actually fuse to the sacrum. So for older people, the coccyx and the sacrum actually become one single bone. So how are you going to remember that there are 7 cervical, 12 thoracic, and 5 lumbar vertebrae? You are going to remember breakfast, lunch, and dinner. You have breakfast at 7, you have lunch at 12, and you have dinner at 5. And to remember the names of these sections, you might remember that you have cereal for breakfast at 7. You have tacos for lunch at 12, and then you have lasagna for dinner at 5. You're welcome. Notice also that while the vertebral column is straight from the front or the back, it is actually curved in 4 distinct curves. So the primary curves, the first curves that appear are the thoracic and the sacral curves. Those appear during fetal development, very early in fetal development. Now remember that the body of the vertebrae, so the smooth side is the anterior side, the pokey side is the posterior side. That makes sense. You wouldn't want the pokey side poking against your internal organs. So if you think about it, if the head is facing this way anteriorly, the thoracic and sacral curvatures are the curvatures that your spine needs when you're in the fetal position or curled up in a ball. The other curvatures develop later after birth. The cervical curvature, which actually curves the neck back toward the posterior side so that your neck holds your head up straight. This one develops at about 3 to 4 months when a baby starts holding their head up. And then the lumbar curvature, which also curves a little bit to the back, develops when the baby starts to stand and walk on their own. And so when somebody says, hey, stand up straight, what you're actually doing is positioning your vertebrae in these proper curvatures. So we have these 4 curvatures, and this is the development of them, okay? And of course, development can always go wrong. One thing that happens often in old age is an excessive bend of the thoracic vertebrae in particular, sometimes the cervical as well. This may result from osteoporosis or from compression, that's supposed to say compression, fractures, tiny little fractures that appear especially on the front of these bones as a result of stress. Stress on the bones, not like stressful emotions. And this is called kyphosis. So we used to call this like a widow's hump or something, or a hunchback. That would be kyphosis. Lordosis is an excessive swaying or excessive curvature of the lumbar vertebrae in particular, might be as a result of compression fractures on the posterior side of the vertebrae. This often happens to women during pregnancy or to people who have a lot of belly fat. That can also cause a lordosis. Scoliosis is something that usually happens during childhood, and it results from the right and left sides of vertebrae not developing evenly, so that one side is shorter than the other, and there's a lateral curvature in the spine. So rather than going straight up and down vertically, it curves sideways. This can be fixed surgically. Sometimes it can be fixed with bracing. It usually does need to be fixed because the discs between the vertebrae are going to be pinched, and that can lead to severe problems. So here's an example of a fairly severe scoliosis, and you can see that this one is actually a double or almost triple. There's like an S curve here. So there's one curve this way, and then one that way, and then back this way. Oops, sorry. And this patient, this was the sister of a former student of mine, and the doctors actually said they weren't going to fix it because her head was straight on top of her sacrum, so it actually did straighten out, and there was just a pinch in the middle. But if you can see these bones in the middle, and see especially this here, you can see that's a really uneven gap, and this disc is being pinched on this side, and that can actually end up pinching the nerves and causing nerve damage. So you know, if you have a condition and the doctors say that it's not worth fixing, you can always ask for a second opinion or a third or a 12th until somebody gives you a reason that makes sense. And to me, this did not make sense. So anyway, that's just one example. Now, one thing that we are seeing developing recently is the reverse curvature of the neck. So your neck is supposed to curve so that your head sort of goes back, right? But we spend so much time looking down, especially kids looking at screens as they are growing up, that we're starting to see reverse neck curvature in very young people. And this used to be something we only saw in old people. When your neck has the normal curvature this way, you can see that the spaces between the vertebrae are nice and even. When you develop a reverse curvature, you can see that it actually can deform the bones and pinch the discs between those bones. So now I am someone who spends all day looking at my phone. So believe me when I tell you that I am a hypocrite when it comes to this one, but do spend some time not looking at your phone, okay? Look up at the TV for once, okay? Go take a walk without your phone and go look at the world around you. Do some neck exercises to strengthen the back of your neck to help pull the back of your head down and fix that curvature of the neck, because this can cause problems later in life. So that's where we're going to end this section, and then in the next section we're going to start looking at the vertebral bones themselves and the markings, processes, and facets on these bones. So stay tuned for that.